Is your lifestyle causing your erectile dysfunction, or is it time to seek professional help? Nobody wants to bring up the topic of impotence in men. And because no one discusses it, many guys believe that they are the only ones experiencing difficulties with their erections. That is not the situation at all. It is estimated that up to 2.5 million men in the UK are currently dealing with some form of sexual dysfunction at any given moment. The perspective of the consultant. What are the factors that lead to erectile dysfunction? The inability to achieve and/or sustain an erection that is suitable for sexual activity is known as erectile dysfunction. Erectile dysfunction will affect approximately 20% of men at some point in their lives. The use of anabolic steroids to gain muscle mass, low testosterone levels, stress, and other factors can also contribute to low levels of testosterone. Heart disease, high blood pressure, diabetes, and diabetes-related complications are other common causes of low levels of testosterone. Despite the fact that erectile dysfunction can place a significant strain on a relationship, over half of all men choose to ignore the issue. What steps can I take to improve my own situation? Quit smoking. Improve your nutrition by reducing the amount of fat and red meat you eat. Cut back on the amount of alcohol you drink, and start an exercise routine. Request that your primary care physician examine both your blood pressure and whether or not you have diabetes. What kinds of therapies are there to choose from? Following the completion of a clinical evaluation, we will go over the various treatment options for erectile dysfunction with you. Tablets, medicated pellets, testosterone, if it's appropriate, mechanical devices, or penile injections, if they're necessary, might all fall under this category. Both psychological and physiological factors may be responsible for erectile dysfunction. We've compiled our 10 best pieces of advice to help you steer clear of some of the most widespread causes. Taking care of oneself can be the answer to the question of how to avoid impotence. But before we reveal them, click that red subscribe button. Number 10. Take care of your diet. If you really want to take care of your health, one of the most important things you can do for yourself is to eat well. Erectile dysfunction can be caused by disorders such as heart disease and diabetes, both of which can be reduced by eating a diet that is well balanced. Eating well can also improve your mental and physical health and make you feel better overall. According to a number of studies, there is a significant connection between food and impotence. Erectile dysfunction is less common in men who consume a diet rich in whole grains, fruits, and vegetables, limit their intake of processed foods, and limit the amount of red meat they consume. Number 9. Strive to keep your weight in a healthy range. Impotence is a common complication that can arise from obesity and the associated health problems. Men who maintain a body mass index, BMI, within the normal range have a lower risk of developing sexual issues. Number 8. Keep yourself active. In the same way that maintaining a healthy diet can enhance your general health, engaging in regular physical activity will assist in the prevention of the physical problems that can lead to impotence. It has been demonstrated that making even a modest adjustment to one's routine, such as going for a walk a few times a week, can result in an improvement in one's symptoms. Number 7. Refrain from drinking too much alcohol. There are a lot of guys out there who are aware of the fact that if they have a few too many drinks, it can impair how well they perform later on that evening. Alcohol consumption, on the other hand, has been linked to persistent erection problems. If you are having issues, it is possible that you need to reduce your consumption. Number 6. Stop smoking. If you smoke, there is a greater chance that you will become impotent. That information is printed on cigarette packages for a valid reason. It's possible that your smoking habits are responsible for your inability to get or keep an erection going. Studies have indicated that smokers are more likely to suffer from erectile dysfunction than non-smokers and former smokers. This is especially true for current smokers. Number 5. Get a decent night's sleep. Along with proper nutrition and regular exercise, quality sleep is among the most critical factors that determine overall health. Your risk of developing erectile dysfunction may be increased if you get insufficient, disordered, or otherwise disturbed sleep. Number 4. Be mindful of your emotional well-being. Stress and anxiety are two examples of common mental health conditions that can manifest themselves in a variety of physical ways. One of them is impotence, which can occur both temporarily and permanently. Relaxing practices such as meditation and mindfulness can be helpful for improving mood and relieving stress. You should also make it a point to engage in activities that bring you joy. Maintain your interest in your activities, spend time with loved ones, or even just give yourself a quarter of an hour to unwind. Talk to your primary care physician or a consultant if you feel that your mental health is seriously deteriorating. Number 3. Monitor both your blood pressure and your cholesterol levels regularly. It has been demonstrated that both high blood pressure and high cholesterol levels contribute to an increased risk of impotence. It is time to take action if you are aware that you have a problem with either of these things. In this section, we have advice on reducing your cholesterol, and in this section, we have ideas on lowering your blood pressure. Discuss the possibility of getting your blood pressure and cholesterol checked with your primary care physician if you have never done so before. Number 2. Make sure that you are taking all of your medications. There is a possibility that the health of your erection could be negatively impacted by the use of certain prescription medications. Talk to your healthcare provider if you believe that the medicine you're taking could be the root cause of your impotence or a contributing factor. They will be able to provide you with guidance on the most effective way to proceed. Number 1. Talk to someone. When things aren't going the way you want them to, having a conversation about sexual encounters may be a really humiliating experience. But if you keep quiet about it, the problem can get even more severe. Communicate with your partner. Talk it out with a close friend or family member. Have a conversation with an expert. The problem will not go away if you continue to worry about it without taking any action to fix it. What exactly is the disease known as Peyronie's? Peyronie's disease is a condition that causes the penis to bend abnormally during an erection, which can make it difficult to have sexual relations with another person. Peyronie's disease affects between 5 and 10% of males at some time in their lives. At the moment, the factors that led to the development of this illness are not completely known. What kinds of therapies are there to choose from? In order to correct the deviation, you may have the choice between mechanical devices, enzyme injections, or surgery if you suffer from Peyronie's disease. Penile prosthesis surgery is an option for patients who have exhausted all other treatment options for their condition. Cigarette smoking can damage blood vessels and reduce the amount of blood that flows to the penis. In addition, nicotine causes the blood arteries to constrict, which might reduce the amount of blood that reaches the penis. Stay away from sexual encounters that could endanger your health. If you can't believe it, there are some cases of erectile dysfunction that are caused by injuries that occur to the penile area during sexual activity. A few helpful strategies include moving slowly and avoiding getting into specific positions. Even though it could be unpleasant, you should think about having a conversation with your doctor about what to do and, more importantly, what not to do. This is it for today's video. Make sure to like this video and subscribe to our channel if you're interested in watching more content like this.